You're listening to the Be Better Off Show by Kelly+Partners.
Well, welcome to the Be Better Off Show, where we find great Australians to bring amazing information to our audience of clients and friends to help them be healthier, wealthier, and wiser. And today, I'm particularly excited for a few reasons. Not only is our guest a distinguished Australian with an amazing academic and practical background, but also he's been knighted by the Queen of England and goes by the title of Sir Edward Byrne. Good morning, Sir Edward.
Thanks very much, Brett. I think that's a vastly generous introduction for someone of my humble capacity, but thank you.
Terrific. Now, your background, I'd love you to share. I always say at the beginning of our podcast, and I like to start at the beginning because the beginning is a good place to start. Where were you born? Did you have brothers and sisters? And your sort of schooling and then early academic career, how did you get launched off in this life?
Well, I often think back on that. It goes back to my dad, really. He was a GP, family doctor in the north of England on Tyneside. And while he was in the army, he served in the British Army in the Second World War. He met a lot of Australians in the desert, and he always had this desire to move to Australia. So when I was 15, out of the blue, he accepted a job as a psychiatrist. He was a sort of GP psychiatrist, really, in Tasmania. And our family upped and moved. So I did most of my schooling in the UK, but what was then called matriculation, the last bit I did in Tasmania. As a young guy, I didn't really know what I wanted to do. My dad was a doctor, and I probably drifted into medicine. They just opened a medical school there, so it was possible. As I got into medicine, I really enjoyed it and realized I wanted to specialize. So I moved to Adelaide to do young doctor years and finish clinical training, and then went to London at the Institute of Neurology, which is sort of mecca of neurology. Finished my training there and did a doctorate. And I made a sort of small discovery, really, in an area called mitochondrial disease, which led to me being made head of neurology and later neurosurgery at St Vincent's Hospital in Melbourne at quite a young age. And I'm going on a bit, but I then pursued a career in clinical practice. I looked after a lot of people, and I had research labs, and the research gradually took over. And this led me to be, head of medicine, dean of medicine at Monash University. I had been at the University of Melbourne, then I went to Monash. Then I went to London to run health and medicine at UCL, which is Europe's largest health university. And these were all unplanned steps. I got invited back to be the head or the vice chancellor, as it's called, of Monash University in Melbourne. I loved that. I did a term and a half with that. And that went well. And then I got invited to do the same job in London at King's, which is one of the top universities in the world, lots of Nobel laureates and what have you. And my wife and I wanted to spend some time in London, in part for family reasons, but in part because it was a great job opportunity. So I've just come back to Australia, having done these various roles. I did various board roles, health roles around the university roles, and I'm now I guess at a winding down stage of my career, Brett, but I've still got a bit of portfolio. People, I think, want me to do some governance and advisory roles, so I'm quite enjoying that.
And you've taken on this role at ANU, I read this morning, to assist them. Yeah,
it's called Vice Chancellor's Distinguished Fellow. It's a role advising the VC there, and especially on the medical side, and the head of their health schools. And I chair an external advisory panel, and I'm helping just with some general advice in a few areas. ANU. Australia has some fantastic universities, but ANU is, of course, one of them.
Yeah, terrific. Now, you were over, I thought of you, we met at a lunch, it seems like in another universe when you could go to a restaurant and you could talk to people, and it was a terrific lunch. But at that lunch, you shared some information about your experience of the COVID outbreak in London and how you were involved and what you've learned from that. Would you be able to share some of that story with us?
Of course. I, as well as leading the university, I chaired the coordinating health board for many of the big health trusts in South London. And this was an absolute hotspot for COVID, in part because of a large Afro-Caribbean population, and in part because it's an area of low socioeconomic status, if that's the word, both things that predispose to COVID. So the boroughs of Lambeth and Southwark, where the hospitals I was involved with were in the absolute hotspot of COVID in the UK. Two of our big hospitals became intensive care wards, totally devoted to COVID care. Some thousands of patients were treated. By the time you got in the hospital, fatality rates were pretty high. So, reaching at times up to 50% in our ICUs. So it was incredibly traumatic for patients, their families, the staff. Certainly the most stressful time in health that I can remember. I wasn't on the front line. I was in more a governance role, but I could see that in my colleagues. At that stage, when people were diagnosed, they didn't really, and admitted to hospital, they didn't really see their families again if they became terribly ill because of the isolation that was imposed. And it was a terrible time with shortages of everything, not enough protective equipment, not enough ventilators. So the whole system creaked, but just got by. And of course, there have been a number of waves since. And the UK, which I've now left, is in an endemic COVID situation, as is France, as is Scandinavia, as is Israel. Unfortunately, I think the situation that we're moving towards in Australia, where you have significant background levels of the Delta strain, which is much more infective strain, as we all know. And most, hopefully, eventually all vulnerable people are protected through vaccination against severe illness. And you have adult vaccination rates, well, even from 12 and up, hopefully a little above 70%. So society gets back into some sort of normal rhythm, but not like it was before, because unfortunately COVID is still around.
So it's amazing experience, and I really appreciate you making the time to share it with us. When you mention sort of England and France, Italy, Israel being in sort of endemic COVID situation, what, for our audience, what do you mean by that? Does that mean it stays? It's at a low level?
Well, hopefully it will go eventually, Brett, but it means it's here for quite some time to come, and look, I'll give you the example of Israel. Israel got its people vaccinated very early. It had a contract with Pfizer, so it was the leading country in the world in terms of early vaccination, and it almost eliminated COVID. I think there were times when they got down to pretty close to zero. But when Delta came with its increased infectiveness, it swept through Israel, and now they're having close to 10,000 cases of Delta a day, with hospitalizations and deaths, which is terrible, aren't anywhere near at the level they might have been in the earlier waves, because vaccination protects vulnerable people pretty well. But still, 40, 50 deaths a day, which is a lot more than we're getting at the moment. If you look at the UK, which has had probably the worst COVID of any Western country other than the US, currently, Delta was coming down, but it's going up again. So currently, over 40,000 new cases a day, some 9,000 people in hospital, and deaths running at about 100 a day, which sounds a lot, but it's only a small fraction of what it was with similar case numbers prior to vaccination. So what does it look like? You've got to get those vaccination rates up close as you can to 80% of 12 and up. Which means it equilibrates out at about 65% because you haven't got children vaccinated. And that protects most vulnerable people against hospitalization, severe illness, or death. It doesn't protect entirely against milder infection or transmission. And you have a situation there when the case is in the background, where there's increased hospitalization beyond what we have at the moment, because I think if we open up at that level, which I believe we'll have to, there will be more cases again, and we'll have more hospitalizations than we have now. And unfortunately, probably more fatalities, but not at the massive numbers we've seen in other parts of the world. So it will equilibrate, COVID in the background, most of our people vaccinated, measures going on to protect vulnerable people in nursing homes, the elderly, immunocompromised, who will have to take special precautions around. I believe that will involve things like rapid antigen testing in certain situations, some ongoing social measures like wearing of masks indoors. And I think we'll get by, but I expect there'll be a number of spikes, over the next 12 months or so. The other issue we'll have in Australia is, the country did so well initially by keeping COVID out, by closing the borders. When we do open international travel, we will be opening to a world where there's more COVID than we have in this country. Unless we keep the place closed off forever, we're going to have our systems ready for that. Sorry, I rattled on it. I think that's
I think that's a great summary, because we get so much input. There's so much coming through various news channels. It's almost as if no one agrees, and often the people that are speaking don't have the professional background or the practical experience to really say as much as they do, I suspect. So it is particularly confusing.
In simple terms, people who talk about the COVID experience where the world's been through the day is like the flu. I've never experienced it at first hand. In the UK, some 1,000 doctors and nurses died of COVID. That doesn't happen with the flu. In Indonesia, hundreds and hundreds of medical staff have been dying each week. And of course, thousands of other people. The US, before this is over, may well have ended up losing close to 1 million of its citizens. That isn't the flu. But with all of the protective measures coming into place, especially vaccination, and with ongoing carefulness, we'll be able to open up. And it will be, I think, to society like a very severe flu-like illness lurking in the background, but something that we need to take particular precautions around for some years to come. And that will involve inevitably booster vaccinations. It's Israel's already rolling that out. It's obvious that's going to be needed.
And how do you see Australia's responses progressing at this point? I think generally we feel like we were behind on access to a range of vaccines, that the response seems to have been a little disjointed, at least from an information point of view. How would you mark our response?
No, I think that's difficult. Having seen the response in the UK, which was totally overwhelmed early on. The planners had been getting ready for an influenza pandemic, and what they got was a COVID pandemic, and the country was just totally unprepared for it. And, on several occasions, health systems came close to being totally overwhelmed. And of course, per capita, the country has one of the highest fatalities in the world. And the government appeared to be constantly playing catch up. But I wasn't so critical of government because the situation was changing all the time. In Australia, I think it's even more complex because the government did incredibly well initially. They had the courage to close the border when nobody else was. And that gave the country a huge head start. And then they were very unlucky. They had a lot of their eggs in a domestic vaccine coming out of Queensland that had the overlap with HIV testing and had to be withdrawn. And the AZ vaccine that we had through CSL, large amounts coming through, there was the complication of the clotting phenomenon, the cerebral venous thrombosis, that scared people and put people off it a bit, probably more in the end than was needed, because, the AZ vaccine certainly saved the UK. But those two things together meant that we just didn't have enough vaccine, and we've been playing catch up ever since. But the government's done pretty well. They've accessed everything they can get as early as they can get it. You just look at how they things are rolling out in New South Wales at the moment. It looks pretty good to me. We're going to have a lot of our population vaccinated by the end of November. It is catch up, but I don't blame them too much. I think it's just been extraordinarily difficult. To me, the test of government will be how well they handle the pandemic phase. Do they get the right messaging across to the Australian community about the care we have to take to protect our vulnerable, even when 70 to 80% of the population are vaccinated? Do they have they got all the other measures lined up as they are in Israel and France that we'll need to have? So people get ready for it, because I think the Australian population, as in the UK, they have fantastic willingness to do the right thing to protect themselves and others. And I just think we need probably a greater clarity of messaging about what's coming rather than what's here now. We've got good people, I think it'll happen.
Yeah. So we with this pandemic phase that you speak of, you say once we're 80% plus vaccinated, there's an opening up more of business. What are the measures that you see have been effective in the UK and France and Italy for people to consider and make sure that they participate in?
Well, we don't know quite how effective they are yet, because they're right in the midst of that now, whereas we won't be in the midst of it until December, January, and hopefully we'll have got, through the measures, especially that the New South Wales and Victorian governments are taking, we'll have our case slowed down a bit. So we won't be, hitting those months with the severity of the situation that's currently present in Israel or the UK. But we don't know that. And with an R factor of 6, that is, one infected person is likely to affect 6 others. It doesn't take that many cases in the community before the Delta strain builds up again. So I think one, ongoing, and I think government's doing most of this, but one, ongoing pressure to get as many people vaccinated as possible by clear explanation, in fighting perhaps even more actively all the misinformation that has led to vaccine hesitancy. And then secondly, and I think I'm really delighted that they've got the stock to do this. This is acquired with Moderna and Pfizer, but planning now for the booster. So, there's people get their appointment for their booster at the right time in the new year. Thirdly, an active series of measures to protect the vulnerable, especially the elderly and nursing home people, but also people who are immunologically depressed. And that will involve advice about what they need to do themselves, how they need to be more careful, and it will involve special measures to protect them in places where they might have to be. That may be a series of special measures around nursing homes, but also in areas where people have to be, like certain large supermarkets, etc. Bringing in antigen testing, rapid antigen testing, something I'd be using a lot more, and that's starting to happen in Europe and the States. And then reminding everybody, this is a mistake Boris Johnson made, that he talked about Freedom Day, then he withdrew it, because there was no Freedom Day. It was a nonsense. And just making sure we don't repeat that mistake here. They'll certainly be opening up and we'll be certainly getting back to normal, but it's not Freedom Day if by that you mean COVID going away. We'll need to continue to wear masks indoors, for quite a long time, continue to wash our hands, continue to be careful, all of these simple measures. I'm very impressed by, particularly by the federal health minister here. He seems to have done a really good job, and the departmental people around him seem to have done a good job. To talk about one slightly difficult thing, we are going to have to sort these different state approaches out, that South Australia, Tasmania and West Australia, they're going to be in a different situation if they keep their borders closed with virtually no cases, and it's going to be a problem for them when they re-enter the country.
Yeah, and when you think about that, as unreasonable as it seems, it would be difficult to be the premier of a state like WA with no COVID, open up and flood your state with cases, particularly when it seems that their vaccination rate is a long way behind other states, and in particular in their remote Indigenous communities seems to be almost non-existent.
I think it's going to be impossible for them to open up until they get their vaccination rates up to, as close to 80% as they can. Well, I wouldn't say impossible, but it's going to be difficult, isn't it? So the figures that the Morrison government has adopted from the Doherty Institute, I think, don't apply just to the whole country. They probably apply to each state. Yeah,
I think so. And I was listening yesterday that they're very southern and very northern Indigenous communities that are almost entirely unvaccinated, and that they just haven't got any penetration rate that makes sense.
I'd be terrified about that if I was the government. I think they need to be protected in every way, and one just has to look in. Not that it's a direct analogy, but the devastating waves of COVID that have gone through Brazil, through India, and are now, in Indonesia to our north, where it's just been dreadful. The vulnerability of non-urban communities when this gets out is very high.
Yeah, and is that exacerbated because of the lack of health services? Is that the primary reason?
Well, yes, it all adds up, doesn't it? I was thinking about this a while ago. I think. One thing people have been reading about more, and there have been a few books about it, is the Spanish flu after the First World War that killed huge millions. Was it 50 or 100 million, a massive number of the world's population at the time. People have pointed out that COVID isn't quite as bad as the Spanish flu, which is true. But what they haven't taken into account is that when the Spanish flu came through, there were no antibiotics for secondary infections. There were no intensive care wards. There were no ventilators, et cetera, et cetera, et cetera.
There's almost no healthcare.
There was almost no effective healthcare. And we have countries in the world where healthcare is really poor compared to the standards we have in Australia, the UK, or the States, like most of Africa. So, people there are really vulnerable, and we haven't seen the worst of that yet. Now, where in Australia is our healthcare the poorest? It's a national disgrace, but it tends to be in some of the first Australian communities.
Yeah. So that is. I think I read yesterday that the WA Premier has taken the police minister or police commissioner and put him in charge of a COVID response to those communities, because they're not making any ground there. So when you hear the simplistic arguments about just opening all of the states at the same time, if you've got significant Indigenous communities in Western Australia with no coverage, it's, even if it's politically viable, it's morally a huge problem.
Well, I think one thing we learned in the UK is that it's not that governments need to be totally guided by medical and scientific advice. They need to know it. They need to have the best quality advice. They had that there, and I believe we have it here. But it's just so crucial that the hard political decisions that have to be made by political leaders aren't too influenced by politics, if you know what I mean.
Totally. And it's interesting that you raise that, because I think many Australians would think, where they don't even have particular expertise in that space, that this pandemic has been unusually politicized, given the health nature of the crisis. I remember pre the US election, we had Biden and Harris saying they would not take a vaccine that was, developed with any influence from the Trump administration. And yet, I think you could claim with the amount of money the US government threw at these vaccines that is the case. But the moment they turned up, they were taking them, and that seems to have fueled a whole politicization around the pandemic, around the vaccines, and led to vaccine hesitancy.
No, it's terrible. I wouldn't have imagined 10 years ago that we would be in such a different world. Global politics are different. Australia's relationships with China, which seemed to be going so well. I was involved in that for a while, totally imploded. You see that with the Trump's blaming of China for release of the vaccine. I think that's another interesting story. I'm not an expert in that, but I'm reasonably sure that no sane country is going to deliberately release a virulent vaccine into its own population. So if it did
a virulent virus.
A virulent virus.
But you wouldn't think, and I think amongst the well-educated in the West, most people wouldn't think that a regime would engage in wholesale forced abortion or imprisonment of the Uyghur population or slave labor or numerous other offences.
And I've seen that at first hand, the Uyghur situation. My wife and I visited there on the last Westlands Inn. No, I was just saying, I'm not indicating that it's impossible that it might have escaped by accident.
Yeah.
To a massive Chinese city, but I don't think they would have released it on purpose. So I think it's either an accident or it's a natural phenomena. We may never find out, but it's an unmitigated disaster for everybody.
Yeah, it is. There's no question. And I was going to ask you, so on the origin debate, where did it come from? How did it happen? And what was the World Health Organization's response? If it becomes a mystery unsolved and people lose confidence in institutions like the World Health Organization, and then there doesn't seem to be any, pursuit of where did this come from and how did it happen to a rigorous degree, then all of us, I guess, I certainly feel some fear that it will be difficult for us to know how to prepare for the next thing or know how to stop it occurring.
I look at it slightly differently to that. I still think I'm not an expert, but I read what a lot of people I respect say, and including some of the great virologists. And I still think the balance of evidence is more towards a naturally occurring phenomena than an inadvertent escape from a lab. But I recognise that either is possible. And looking back, I almost see that I think there will be more information emerging, and we will get more information with the strength of modern science. I think it's almost now a secondary question. The key question to me is that pandemics are global. They can only be dealt with in a global way. And we need to have confidence in our global institutions, including the WHO. And I think at a number of levels, the WHO has not covered itself in glory in this thing. So, the Americans withdrew, then Biden brought them back in. And I would hope that we'll see some rebuilding of capacity and independence in the WHO, so that people around the world, as they always have done, who would have had any lack of confidence in the WHO in the past, And so I think we need to get that confidence back, and it has to be it.
Yeah, and it's just pandemic readiness, I guess, now has entered the consciousness, which hopefully will serve us for another 100 years to say, how do we build, preparedness, confidence, ability to work together?
It's almost like science fiction, isn't it, how this has come out? It would just have been unbelievable. I remember attending a lecture by a very prominent English academic years ago, in which he showed in one of his graphs the pandemic spreading through airports and going all over the world. And it's just what's happened, And I looked at that, I thought, that's never going to happen.
Yeah, look, it's amazing. And on the other side of it, I'm sure a lot of lessons will be learned. From your long experience in sort of public health and related disciplines, what do you see as the big lessons for our governments and our people in terms of, what we can do better going forward?
Well, my background, as I said, I'm a sort of neurologist in my health career rather than public health, but I've run large universities that have had massive public health capacity. 3 or 4 things stand out to me. We developed a very lean health system because health delivery is expensive. With very little capacity for emergency or urgent situations. And I think we're going to need to have more capacity in the health system going ahead to deal with bad things when they happen, surge capacity. Look, secondly, supply chains have been disrupted severely by this. And I think we're going to have more in-country manufacturing capacity for key things. And the third thing, which I see everywhere, are health workforce shortages. We didn't have enough doctors and nurses to start with in most countries. People dropped out because of infection, because they'd been pinged by an app and they couldn't go to work, because of psychological stress and because of burnout. Health systems that have been propped up by international movement, recruitment of nurses and doctors like Australia and the UK, that all stopped. So workforce issues are all over the place. So it's almost as though there are a series of bushfires that need to be put out. I've got this role as a global medical advisor for Ramsay. They've got 600 hospitals around the world, and they're very big in France, Scandinavia, the UK, as well as Australia, and with some presence in Malaysia and Indonesia. One thing I've been interested in for a long time is how private health provision and public health provision sit side by side and coordinate effectively. And in the COVID pandemic, we've seen that happen quite a bit because the private system has really, had to put its best foot forward and fill all sorts of gaps by taking overload capacity from public systems, by doing some of the COVID work directly, by providing workforce, even for things like vaccination centers, and I think around the world, especially in the UK and Australia, the degree of goodwill from government and the public sector towards the private sector has never been higher.
It's terrific. So, final question for our audience, I think they'd be interested in thinking about how do you protect your family going forward in the Australian context? Does it make sense to be outside high density areas, wearing masks, when indoors, getting vaccinated, making sure your kids are vaccinated 12 plus? What are the things you think practically?
I think you've covered most things. I wouldn't recommend that people run for the country and abandon an urban lifestyle because I think any advantage to them from that's going to be very small. I think the key thing is vaccination as it becomes endorsed and approved, which is very soon 12 and up. Being aware of the need for boosters, being aware that vaccination gives a high protection against severe illness. It's not 100%, but it doesn't give such a high protection against mild illness or the ability to infect others, and therefore continuing to be careful even when vaccinated, wearing a mask, avoiding dense environments, hand washing, all of these simple things. And hopefully, governments, I think, will step up and get a, more clearly defined policy with things like regular testing, either PCR testing or antigen testing.
Yeah, terrific. Sir Ed, I'd like to thank you so much for your time today and ask you, when you were knighted, was that a surprise? What was it for? Did you meet the Queen, and did she get the sword out? Did you have to kneel down while she got the sword out?
No, I think that would have happened, but it was in the midst of COVID, so that's something I'm looking forward to. But it might be Prince Charles rather than the Queen. I think, how do you know when these things happen? The biggest thrill of my life in that sort of terms was getting an AO many years ago. And I think that was for my medical science. And then another thrill was getting an AC, which is a companion of the Order of Australia, which is Australia's highest honour, which I got in 2014. The citation, I think, said for international health and leadership of universities. The UK one, I think, was really, for playing a leadership role in the university sector, but also doing an enormous amount of stuff in health and in London. And, you always say when you get these things that you're a bit lucky because any number of people probably have done more. But it's nice that somebody spotted that I've done something.
Absolutely. It's always nice to feel appreciated. So, Sir Edward Byrne, I want to thank you so much for your time and to our audience. I feel it's an enormous privilege for us to have had Ed's time today to share his real insight into these issues. And I hope that everyone that listens gets some benefit. And as I like to say, have a great day.
Thanks for listening to the Be Better Off Show. If you enjoyed this episode, don't forget to rate and review on Apple Podcasts.
Have a great day.